Thanks for joining us on this Friday afternoon. First tonight, hospital beds in Central Texas filling up fast.
As of this afternoon, there's only one adult ICU bed available for a population of close to 2.5 million people. As we look deeper into the numbers, less than 2% of ICU beds are available and staffed in Central Texas. That means it's one adult ICU bed and 6 pediatric ICU beds. During previous COVID surges, local hospitals handled a higher number of ICU patients, but this time fewer healthcare professionals are available to work. Today, health leaders said most Austin area hospitals have reached capacity or are close to reaching capacity. Only 10% of hospital beds are available this afternoon. Austin public health leaders do not plan to open an alternative care site, saying they will instead focus on the hospital staffing shortages.
Now, one of the reasons hospitals are stretched so thin is that more kids are going to the emergency room with COVID. Pamela Combe joins us now live. And Pamela, health leaders are concerned about the number of kids being admitted to the hospitals.
Brian, right now there are actually 36 children in local hospitals with COVID-19, and that's actually the highest it's been since the pandemic began. In the last 2 weeks, 91% of kids admitted to Austin area hospitals were unvaccinated.
Olivia and Eli. These siblings, both 9 and 11, were one of the first to roll up their sleeves in November and get the COVID-19 vaccine. Their mom, Julie Zweig, is happy they're both vaccinated, especially after a scare at the beginning of the year.
She was exposed to COVID on her first day back to school. So after 2 years, first day back.
Since the beginning of the pandemic, Zweig hasn't been comfortable with sending her kids to class.
I think when we're in the middle of the most contagious, virus to date, and the hospitals, they told us today they're overrun. And it's like, what else is it going to take to make it to where we have a virtual option?
About 26% of eligible kids in Austin and Travis County are fully vaccinated. Pediatrician Seth Kaplan says as Omicron continues to spread throughout Texas, more unvaccinated children are turning up in hospitals with COVID-19.
They may have additional underlying conditions, whether it is severe obesity or whether it is, chronic immunosuppressing conditions, but there are still a fair number of children who end up in the hospital whose only risk factor is that they're not vaccinated.
Austin Public Health says the majority of children admitted with COVID-19 were unvaccinated. It's hard to keep up when there are staffing shortages. As a result, wait times in hospitals are much longer.
It would be devastating to have your child in the hospital and have it be right now where it's a limited number of people who can visit.
Zweig will do everything in her power to help her kids stay COVID-free.
A reminder, kids ages 5 and older can get the vaccine, and if you're looking to schedule your child's vaccine, head over to KVUE.com. Brian?
Pamela Combe live for us in the newsroom tonight. Pamela, thank you very much.